Mental health has recently become an important topic of research. Depression affects around 350 million people worldwide, making it one of the leading causes of disease burden. Anxiety affects around 4 in 10 people. Treatment for individuals struggling with mental health can be expensive and not useful for many. For those who are undiagnosed but looking for a treatment to what they are experiencing, magnesium supplements could be very beneficial. The question I am trying to answer is magnesium supplementation sufficient in treating mental health conditions? Magnesium goes from intracellular space to extracellular space when you are stressed because of the hormones that get released. Those hormones are catecholamine and corticosteroid. The more the magnesium shifts to extracellular space, the more it is being excreted with urine. This, in turn, decreases the serum magnesium concentrations. Those low levels increase the release of more stress hormones, like the catecholamine and corticosteroid. This affects brain axis, reducing resistance to stress and ultimately creating more magnesium depletion. This is a positive feedback loop that will continuously happen over and over. Magnesium is the second most abundant intracellular cation, making its role very significant. Because it is so common, it is a part of over 600 biochemical reactions. If magnesium is deficient, there would be many pathways that are affected. One example of that would be activity in the hypothalamic pituitary adrenal axis. This is responsible for your body dealing with demands of stress, so with it, stress would be greatly amplified. Another example is presynaptic glutamate release. The more it is released, the more fear, anxiety, and panic responses there are. Magnesium is known to reduce that release by deregulating. There have been many trials conducted looking at the effects of magnesium on mental health. The results from the data I looked at were very promising. One trial was an 8-week randomized controlled investigator-blind trial in France. Half, 132 of the patients, were given a supplement containing magnesium and vitamin B6, and the other 132 were given just magnesium alone. Both groups took 300 milligrams of magnesium daily. Each participant was between the ages of 18 and 50 years old. The test used to determine the level of anxiety was the DASS-24. This is a questionnaire that asks self-reported questions determining the emotional state of depression, anxiety, and stress. For depression, the normal range is between 0 and 9. For the mild range is between 10 and 13. The moderate range is between 14 and 20, and the severe range is between 21 and 27. For stress, the normal range was between 0 and 14. The mild range was between 15 and 18. The moderate range was between 19 and 25, and the severe was between 26 and 33. For this study, participants had a score greater than 18. For anxiety in the beginning of the trial, both groups had most individuals in the extremely severe range, followed by extremely severe. Their depression range was highest in the normal range, followed by moderate. After 8 weeks, the magnesium and B6 group had a 50.1% improvement for the severe to extremely severe stress group. The magnesium alone group had a 41.3% improvement for that same group. Overall, as you can see, both groups showed significantly better results at the end of 8 weeks. Many participants benefited from this and responded that their quality of life had significantly improved. Another trial was a 12-week randomized crossover control trial. Half of the participants were given a magnesium supplement to begin right away, and the other half did not begin taking supplement until week 7. All participants were over 18, no recent change in treatment, had a patient health questionnaire 9 score of 5 to 19, and other health requirements. The PHQ-9 is a self-administered questionnaire to determine the severity of depression. A score of 5 to 9 indicates a mild severity. They also took a generalized anxiety disorder 7 exam, which is a similar type of questionnaire to measure anxiety. Magnesium chloride was specifically used in this trial, and it contained 248 milligrams of magnesium per day. When looking at the PHQ-9, the immediate treatment group improved right away, but went back up a little when they began taking the control supplement. The delayed treatment group improved essentially throughout the entire trial. When looking at the GAD-7, both groups showed less of a significant improvement. At the end of the trial, 61% of the participants said they would take magnesium again in the future. Overall, depression scores increased by a statistically and clinically significant mean of 6 points and over 4 points for anxiety. I would suggest taking magnesium supplements if mental health struggles apply to you. It is proven to be safe through multiple trials, it is inexpensive, and it is relatively fast. Most participants found success through a supplement, and the trials only ranged from 8 to 12 weeks. There is also no differences in effects based on gender, making this an option for any adult.